Ontario appears to have avoided the worst case scenario, at least for now. That's what health officials are saying tonight as they release a new round of COVID-19 models and projections. But at the same time, today's daily infection numbers aren't exactly painting a very comforting picture. Health officials are reporting 934 new cases today. That's 100 more than yesterday, and the fourth highest total we've seen so far. And just as alarming, 10 additional deaths have been confirmed. Another troubling number comes from Toronto, where a record high 420 new cases are being reported. That's a jump of more than 40% over yesterday. Case counts also remain stubbornly high in both Peel and York regions. In total, 766 of today's patients come from the Greater Toronto and Hamilton area. Now, despite those numbers, new modeling projections show the spread of COVID-19 is slowing. Provincial health officials who released the data today say the scenario in Ontario is no longer quite as grim, but also made it very clear COVID is still a very real concern, and we could see between 800 to 1,200 daily cases in November.
Most indicators are showing a slowing growth in COVID-19 cases. The trajectory appears to be moving away from the worst case, but cases are continuing to climb. And so this is not that we have crested and are now coming back down the other side of the epidemic curve. We're just getting to a slower period of growth within that curve.
It's much better news than 1 month ago when health officials warned the health system could be overwhelmed the way Italy's was during the first wave. Although hospitalizations have gone up 56% in the last 3 weeks, the rate is slowing and they're able to cope. But there is a warning that could change.
This disease, particularly because it can spread so quickly with these super spreader events, can dramatically turn and you can have rapid growth quite quickly.
For the first time, officials released a clearer picture of where cases originate. In Toronto, for example, the highest caseload comes from schools and daycares at 22%. Next is long-term care and retirement homes at 18%. Restaurants, bars and clubs, which have been closed to indoor patrons in hot zones under a modified Stage 2, they're at 14%. And gyms and sports settings, also closed in Toronto, are at 3%. In Peel and Ottawa, cases tied to restaurants are also at 3%. They too are closed to indoor dining. But officials insisted shutting the indoor spaces was necessary. The chief medical officer of health says it's too early to say if the modified Stage 2, which was to last a minimum 28 days, will be extended.
The data moves up and down fairly quickly day to day. You need 7-day trends. And then if we have actually 4 7-day trends with 2 incubation periods, we can see, is it a consistent downward trend? So what we don't want to do is saying, you're in modified 2 now, then we come off modified 2, and then a week later we're back into modified 2.
Cases in long-term care are especially concerning. 85 vulnerable residents have died since mid-August. Now, the markers used to measure COVID differ quite dramatically depending on where you are in the province. For example, the positivity rate in Peel is 6.5%, in Toronto 4.8%, Durham 2.3%. And here's a big concern for Toronto. 65% of its cases can't be traced. Compare that to Peel, where the number is 17%. It makes finding and stopping the disease in this city a whole lot more challenging.